oh my gosh, there's so much overlap with eating disorders and our gut. And so, that gut-brain connection, really speaks to how there's this two-way, bidirectional pathway between our brain or nervous system and our gut, right? And just how they impact each other so very much. And so as it relates to eating disorders, so much of the work that I help with within here is a lot of like nervous system regulation, right? Like getting out of our fight or flight state into a more relaxed mode when it comes to eating, as an example, because
Hi, everyone. My name is Isabel Ball, and I'm a licensed clinical social worker and certified eating disorder specialist with Into Place Therapy in Arizona. I'm here today with Liz Lees, who is a registered dietitian and a certified gastrointestinal nutritionist with 10 years of experience providing nutritional counseling and education in the mental health field with a special focus on eating disorders. So we're here to talk about that today. And Liz, you and I met at an outpatient clinic that we worked together at, and we worked together on an intensive outpatient program too. And I've had the pleasure of getting to know you and seeing the relationship that you've built with your clients and the strategies that they've used to help them in recovery. So that's been a big inspiration to me. And I also just want to thank you because you've been a really formative part of my education as a therapist and looking at eating disorders more holistically. So thank you for that. And thanks for being here.
Yeah, but thank you.
So I thought maybe we'd start with just you sharing some of your background and how you ended up becoming a dietitian and working with eating disorders.
yeah. So, when I was thinking about that, because that question comes up a lot, I don't know if there was ever just like pivotal moment of this is what I'm going to do. But I just remember always being really fascinated by eating disorders, like learning about it in nutrition courses. You didn't get a whole lot, but I just remember thinking like that was the most interesting, subject that we've covered. And, in my family, there's some histories of eating disorders, and maybe that kind of in the back subconscious of my head was part of the reason why I also felt an attachment to it. And I love how you brought up kind of just like people who have impacted you in your career, because I have the same. I had a colleague that offered for me to be able to shadow her to get experience, because it was hard to even figure out how to get into the field if you didn't go to a school that was specific for that. So, it was kind of always something I wanted to do. I found a kind of a mentorship opportunity and just kind of fell into place.
That's awesome. And, just kind of backing up, because I think sometimes people get confused with the difference between a nutritionist and a dietitian. So I'd love if you could kind of break it down and tell us why it matters.
Absolutely. Yeah. So a nutritionist is a much more broad term. Anyone who's taken a nutrition course could technically call themselves a nutritionist. There's not necessarily any kind of like guidelines of using that terminology. Whereas a registered dietitian, they've gone through accredited program, a certain number of hours within, supervision. You have to pass an exam, maintain your continuing education, much like therapists would. And so it's a much more rigorous process. And, you've been trained in, medical nutrition therapy and learned, practice policies, ethics, and so forth related to practicing dietetics. So, yeah, that's kind of in a nutshell.
So for someone like struggling with an eating disorder, a dietitian would be the way to go, would you say?
Yeah, and I think it depends on who's all on the team too, right? Like I think there's a great place, for example, maybe like recovery coaches that might have nutritionist kind of backgrounds, but it definitely shouldn't take the place of the dietitian. I think it's a great collaboration in the team, and absolutely dietitians are going to have that more rigorous background of education and internship. And within dietetics, same within therapy, is you can get advanced certifications to become more specialized in, say, eating disorders or other areas.
Mm-hmm. So it's a good option as like an additive. to the treatment team. Gotcha. And so there's all sorts of misinformation out there when it comes to food and bodies and eating disorders. So what are some of the biggest myths that you hear about in your work? All the things. Yeah, I'm sure you've heard it all.
One that pops in my brain, I remember hearing years ago, was someone was like, "Don't multivitamins make you gain weight?" And I thought that was interesting.
Never heard that one.
Like, yeah. And it was actually, I heard it more and more. It was actually within, I was working in a outpatient, more community clinic, and I think it was just maybe a cultural thing that was information within that sub-community of thinking that, taking multivitamins would make gain weight. So it's like, I appreciate that people bring it to the nutrition professional because, if they obviously believe it if they're asking that, but they want to make sure. So yeah, that one definitely stands out. And of course, there's always the latest diet phase, right? Intermittent fasting, I get that one a lot, or keto, right? Carbs make you fat. There's lots of, just certain foods themselves that are, kind of more demonized that, are brought up a lot. But yeah.
A lot of trends like that on TikTok.
Totally. Oh my gosh. Yes. Yeah. I am not a TikTok user for many reasons, but yeah, I feel like I'm in TikTok from how much you hear about it from our clients. But absolutely. I mean, like what I eat in a day and like, just, I don't know, there's all these different influencers following certain diet plans and speaking truth about how that helped them do X, Y, Z. And so a lot of that too is, that misinformation. And, I love teaching social media literacy, right? Like understanding what's the true message in this person's campaign, right? Like, are they a professional? What are their degrees? Do they have ulterior motives and so forth? Because so much of that information is now social media based. I'm glad you brought that up.
Yeah, and I know that, you've worked with a lot of adolescents. I know you work with all ages, but we worked together with adolescents, and so that was huge for sure. The social media piece and misinformation and the fact that people are willing to ask you those questions, I think that says a lot about their relationship with you. As a dietitian.
It's a positive. Yeah. They see you as the professional and they want to know the truth behind it, because a lot of times these messages are, it's saying foods are bad or a behavior they're doing is maybe bad. And, you want to be able to have that reassurance from someone that like, is this okay to do? And clarify it. Yeah, and clarify it. Absolutely.
So you're also a certified gastrointestinal nutritionist. Big words.
I know.
I'm glad I could say it.
CGN.
Which is really cool. So when I was in school, no one was talking about that. We didn't get taught about the gut-brain connection. Of course, it's super important, and there's a whole field of psychology about it. So can you talk to us a little bit about that pathway and especially for an eating disorder, how that's relevant?
Yeah, absolutely. Yeah, and the whole CGN thing came about because I'd had history with GI nutrition, and they suddenly realized, oh my gosh, there's so much overlap with eating disorders in our gut. And so, that gut-brain connection, really speaks to how there's this two-way bidirectional pathway between our brain or nervous system and our gut, right? And just how they impact each other so very much. And so as it relates to eating disorders, so much of the work that I help with within here is a lot of like nervous system regulation, right? Like getting out of our fight or flight state into a more relaxed mode when it comes to eating, as an example, because we know that when we're in that fight or flight, energy, blood's diverted away from our digestive tract, things are kind of frozen, so to speak, and we're not going to probably tolerate that meal very well. And this is further intensified in people who have any pre-existing GI disorders, whether that's IBS, gastroparesis, whatever. And so, yeah, really, really important piece when we kind of talk about like meal hygiene, working with people is before we even get into what are you eating, it's more of a how are we eating? What's our state of mind, right? Are we taking our time, trying to practice mindfulness or just some sort of grounding techniques, right, to to help enhance digestion. So yeah, lots of pieces in there.
Yeah, that connection makes a lot of sense. And, you know, I know we were talking about trends earlier and like gut detoxing. So I imagine that doesn't help everything that you just described. But I mean, what's your take on that trend? And is there any like scientific evidence that supports it?
Yeah, and like even gut detoxing itself can be maybe a broad interpretation, like if that relates to like I'm doing a juice cleanse or I'm doing almost like fasting on certain days as a way to detox, or I'm taking, supplements or so forth. Um, the gut itself is 70% of our immune system. It's helping to protect against toxins and bacteria from absorbing into our bloodstream. And furthermore, I think it's really important to look at like, why are we doing this, right? Now, in the case of something like I have a severe flare of Crohn's disease and I need a week of like, liquids or elemental diet or complete bowel rest and maybe alternate sources of nutrition. That's a whole different story, right? We're treating like an active inflammation in a therapeutic way versus I'm just trying to say reset my gut. I think we need to investigate a little bit more to see, well, what are the symptoms? What are maybe some of those root causes, right, that are causing these symptoms? Is this more of a, hey, I have, leaky gut, which is another kind of trendy term. I don't know if you've heard of it, but it's not like a true medical term, but it refers to just increased intestinal permeability. And so when we have that, our gut isn't able to function as much of that immune defense. Things can get through into the blood that can make us, our immune system a little bit more hyperactive, cause a little bit of inflammation. Sometimes people can get kind of like fatigue, brain fog, different symptoms. And if that's going on, then like overly restricting our diet actually doesn't help that condition. What we need to do is feed the gut bacteria, get them to flourish and grow, because that's what's going to really help with reducing that gut permeability. Now, if, again, there's certain environmental, dietary, whatever things that are causing or contributing to some of that inflammation, right? That's where we really kind of customize and individualize for people.
Mm-hmm.
So to answer in a concise way,
I was expecting
it depends,
right?
Like I would never ever tell someone like, yeah, do that juice cleanse for a week without some real good scientific evidence to back that up.
Mm-hmm. Yeah, we all have something different going on in our bodies, so it really has to be tailored to the situation.
Definitely.
That makes sense. Which makes the trends and whatever else even scarier, because they're not designed for somebody's body in particular.
Yeah.
And, obviously there's a wide range of disordered eating behaviors, and so just examples, right, are purging, throwing up, and restricting, not eating, and binge eating, so overeating to an extreme. What do those different like behaviors do to the gut or our digestive health? Like, what's the impact?
Yeah, definitely. So, I could like to kind of break it down by behavior, but there's also a lot of overlap between them too. So when we look at restricting as an example, and especially if restricting comes with pretty significant weight loss, what we see is loss of muscle tone in our GI tract, much like the rest of our body, right? When our body is just starved for nutrients for so long, it starts breaking down everything for energy. Also, our body adapts to try to slow down motility to enhance absorption when we don't have much food coming in. And so both of those things slow things down. Food's sitting, it's more sluggish, is going to cause constipation primarily. And I tend to see, more severe constipation and more severe anorexia restricting or like ARFID type, restricting scenarios. Not that it can't be in others, but that's where I feel like it's my kind of clinical opinion and what the research shows is really more restrictive based of getting that really severe constipation, and with or without maybe having a history of just kind of like a functional constipation or like an IBS-C. So that's a big one. And then what can come from the constipation is as we're getting kind of backed up with stool, that can cause a lot of bloat, abdominal pain, maybe some distension where it's actually physically, sticking out. That might be backed up enough where it's causing reflux and kind of upper GI discomfort after eating. So, yeah, a lot with that for sure. And with purging and binging behaviors, anything that's just sort of an erratic eating behavior, we tend to see a lot of times that there's this restrict, binge, purge kind of cycle that people might go through. And I always like to kind of describe like our gut moves in cyclical patterns of motility, much like a circadian rhythm for sleep. And so if we're eating really erratically, maybe going all day long without eating, then eating large amounts at once, that can also really mess up our normal digestion and flow of contents. So that could be diarrhea or constipation, maybe as a result, bloating, especially after, of course, ingestion of a lot of food in a rapid amount of time. We're definitely going to have some reflux going on, right? I mean, that's pretty self-explanatory. With purging itself, the repeated vomiting can relax the muscles that hold our contents of our stomach from going up our esophagus. When that muscle relaxes, that's where we can get a more severe kind of GERD or, long-term reflux. So those are some of the biggies for sure.
And, you mentioned the bloating and the constipation, and something I've heard a lot from clients is when they're trying to follow their meal plan, they're like, I have a lot of constipation or my appetite's messed up. And other people sometimes read that as like an excuse, and I think that often gets misunderstood. And so, I am curious, like, do you have strategies for the bloating and the constipation? And then how can you help people kind of weed out the difference between what's the eating disorder and fears versus what's actually going on in their body?
Yeah, absolutely. So some of my favorite go-tos for constipation are really looking at adding in extra minerals. So minerals like sodium, potassium, and magnesium are all working together to help with muscle contraction, again, with gut motility. Now, we're not going to necessarily see like low mineral levels in our blood as an indicator of not having enough dietary intake. Now, in extreme settings, if those levels are getting low, then, that person is needing a lot more medical attention. But point here is my go-to a lot of times is starting with, maybe taking magnesium citrate, especially that formulation has a bit more of a laxative effect. Combining it sometimes with like electrolyte drinks where we know we can get good sources of sodium and potassium. And just pushing, good food sources, right? But it kind of depends on where we're at too, because a lot of our high potassium sources might be fruits and veggies. And if I'm significantly constipated, initially I don't want to overload my body with fiber, which is kind of counterintuitive, right? But it's kind of like laying bricks in cement, right? Things are just going to get stuck and more backed up, right? We got to get things flowing and stimulated. So yeah, I really like starting with those minerals. When it's appropriate, I will start adding in some fiber, whether it's food-based or from supplements. And depending too, kind of going to bloating, some people can be really sensitive to fiber and getting, more fermentation in their gut, contributing to that bloat. And so educating people on the types of fiber, more fermentable to less fermentable, and kind of what's your tolerance. And that's where, again, sometimes maybe supplements of, a kind of a controlled, very easy to digest fiber is a helpful solution initially for someone. And also with bloating, sometimes there comes abdominal pain. And so there's some great supplements out there too, like peppermint-based things that can be really calming, or ginger can be really calming of kind of relaxing the smooth muscles of our intestines, reducing some of that pain or bloat that's associated with it. So yeah, it's kind of just like diving deeper in where is the bloat. So, I mean, I get down into, is it, lower up abdomen? Is it just across the entire abdomen? Is it more upper? Because that can also dictate what intervention is going to be more helpful for someone.
Okay. Oh, that's interesting. Yeah, I hadn't thought about that. The location tells you a whole story about a person. Yeah. Well, yeah, I mean, I think it's so important what you do because, I've worked sometimes with dietitians who maybe aren't, that's not something that they've studied or the gastrointestinal, tract and the relationship with the eating disorder. And that often, I think, can lead to a lot of invalidation for the clients and sort of discouragement because they're like, I really am in pain and I'm not just making it up, so.
And yeah, that to kind of like answer that second part, you prompted me. I was like, what was the second part of that question? Absolutely, like teasing out, where is this coming from? Sometimes our clients might not totally know either, right? Like we can get hyper aware of all of our digestive functions when we just start focusing more inwardly on all of it. And so things that, maybe I tolerated before start feeling like I can't tolerate. And some of it might be, it definitely always stems from a fear base. And I sometimes tell people whether it's a fear coming from the eating disorder or a fear of potential adverse GI complications, different than like an RFID presentation. Like I see that so much. And in that exact moment, I don't think it's necessarily as important to discover which one it's coming from. And rather, let's just focus on building some, safety around eating enough first and foremost, right? And then challenging small amounts and building our confidence, right? Because like any kind of exposure, it's not effective to shove like a whole big, let's say someone's really freaked out about eating beans because they can make them really gassy. I'm not going to put like chili in front of them and say, here's what you're having tonight, right? Like we might start with like one bite of a hummus or whatever, right? Just going at a pace that's safe and comfortable for that individual. And we can then sort of weed out too, like, okay, what are the intrusive thoughts? Am I focusing more on weight gain? Am I fears? Or am I focusing more on just like, how's this going to make me feel? And am I going to, be in the bathroom the rest of the day? And is my stomach going to be sticking out? And, there's also just so much overlap too with body image and GI symptoms, our body not functioning as we want it to. And when we have actual distension going on, that also brings up more body awareness, body preoccupation, and poor body image. So much overlap.
Definitely. Yeah. And even when you were talking about the different locations, the awareness of what are my thoughts and also like, what is my body telling me? And then every food might present a different combination of those thoughts. And so I like what you said. I think that's helpful for people to know that is going to be part of their recovery process too, is learning those things and breaking it down.
Definitely. Yeah. Yeah. We have to kind of just learn to trust our body again.
Yes, sir. Definitely.
And what does treatment usually look like with your clients? I know that's a really big question and it depends, but how would you kind of describe maybe like the phases that you go through with your clients?
Definitely. So when we're, when I have someone who I tend to have more restrictive eaters because I have that niche of GI plus ED, and oftentimes we're very restrictively eating because, again, of that fear of not just maybe the weight gain or, but also how is this going to make my body feel, GI symptom wise. So, yeah, first and foremost is just I establish like regularity, right? Like, okay, eating at kind of regular times day to day, because that's going to really help challenge food rules, right? And setting expectations of like, okay, I eat at these times, right? And making that habit helps, keep the behavior going.
Okay.
And then we start working on a little bit more adequacy, right? So, okay, are we eating the same 10 foods right now because that's all I think I can tolerate symptom-wise? That's okay, right? Like, we can repeat the same things at all of our meals initially if we have to, and just get our body nourished. Because to really make much progress in general, right, with eating disorders, if we're working with an undernourished brain, there's not much that's going to be improving quite yet. So by whatever means necessary to get there, just, getting enough calories in, right? And of course, making sure that we're not eliminating whole food groups either. When we talk about adequacy, we need to make sure that we have enough protein and carbs and fats. From there, really tackling some more variety, right? And this is where, of course, traditionally, in eating disorders, when there's fear foods, we tackle, these foods one at a time, maybe do a fear food hierarchy. When there's that GI component, and again, we're kind of weeding out, like, this might truly just be coming from I don't want to feel awful all day, and that's so valid, right? And so working with really small portions, maybe, one new food at a time maybe it's once a week, maybe it's a couple times a week, whatever, like that's the more that individualized piece. But it could be starting with a really small portion and just kind of habituating to it over time. And what I see is people start building that confidence of, okay, I do tolerate this food. It's not a fear food anymore from a symptom perspective, right? And we just slowly incorporate more foods. And sometimes, especially again in the case of things like IBS, right? They might just have really bad flare days and have to just sort of adapt and manage the symptoms primarily. So those might be days where we're like, you know what, if you need more shakes, supplements, something that's just super easy to digest, doesn't contribute to that bloat, that discomfort, that's fine, right? And just kind of rolling with the changes as they come up.
Sure. And I mean, I think a big goal in eating disorder treatment sometimes is just flexibility.
Yeah.
Whether it's with our feelings or with food. And so I think that's such an important place, hopefully, for people to get to, is like there's a freedom in the flexibility. And so adapting with, not every day is going to be great. And that's not the goal for everything to be perfect. It's just how do I kind of recognize that there's options and use them. That's right. So what do you see people getting kind of discouraged about in their recovery? Like, are there any things that you feel like people sort of lose motivation around or feel really frustrated around, like patterns that you've seen? And how can they kind of address those in recovery?
Yeah. Those persistent GI symptoms, of course, are, not probably number one, right? Of just why won't my body cooperate? Why doesn't my gut dysfunction normal like other people? And that, it's frustrating, right? When we feel like we're doing all the right things, yet we're still having diarrhea or constipation or bloating. And what's complicated too is like sometimes there can be true medical conditions that do flare up and during eating disorder recovery. And so that's another big part that it's so important to do that deep dive of, well, if something new is happening or, we're just really stuck here and we've done all the interventions, like maybe there's something else going on, and just trying to peel back some of those layers and, that team approach too, right? Like, okay, do we need to involve the gastroenterologist for some, testing diagnostics because we have, adequately nourished your body now, yet you're still really suffering with, XYZ that, we might have seen in other people, reverse itself once we get into a, restored body, whatever that looks like. So yeah, I think that one definitely stands out, and, it's just holding hope for people, right? Like time and time again, I tell them this is going to be a long process, not in a way to feel discouraged, but more of don't expect that things are going to shift magically overnight. And I don't know if you see this a lot, but I tend to notice that clients will feel like they haven't made progress, and then you have them reflect like 3 months prior, right? And they're like, oh yeah, you know what? I have come a little bit longer than I gave myself, and our clients tend to be really hard on themselves and, those overachiever perfectionists. And so even just helping them to see, hey, maybe we're not as stuck as we think we are.
Mm-hmm. Mm-hmm. Yeah, that's huge. And I think what's cool about that, maybe from your work, is that you have sort of maybe more tangible markers sometimes of that for a client.
Sure. Like, what were you eating there? What are you eating now?
Mm-hmm. Which is really important, because I think in the therapeutic world, there is something to that for us, but I think it is more tangible in a way with the food and with the meal and thoughts about the food. So
yeah,
that's really cool that you can give people that sort of motivation and bigger picture perspective.
Yeah, you have to, just get them to reflect, and they don't think these things actively on their own a lot of times, right? They just come in feeling frustrated and, all these things were hard this week, and then you're like, well, what about the good stuff, or what went well, or what were you proud of? And oftentimes people can find at least one or two things, and it just kind of changes the perspective.
Yeah, you're a good cheerleader for your clients.
Yes.
So I'm curious too, a lot of people that I've worked with are sometimes hesitant to start working with a dietitian, understandably so, with an eating disorder. So for someone who's nervous to take that step in their recovery, what would you say to them?
Yeah, absolutely. And unfortunately, much like any profession, right, you might have had a bad experience with someone who was, the whole joke is, we're not really the food police, but a lot of times that is the initial perception, right? You're going to tell me what I have to eat and make me gain a lot of weight. And, so I think just having that, if you have the ability to at least make an initial contact with someone, just even offering like an initial discovery call, right? And just kind of explain, like, here is my tactic, right? Like, this is collaborative. I'm on your side. I'm helping align with your goals, right? I want your input. If something feels unsafe or you're not open or ready to do that, then let's talk about it, right? You're not going to get in trouble. There's no consequences. So I think it makes a huge difference if you're even able to share that piece with someone, that like some of their guards come down and they're like, oh, okay, you're actually like really nice. And I thought you were the scary dietitian. And you know what? There's a lot of scary dietitians out there. So it's not coming from a total foreign place. But yeah, I mean, it's just like anyone you work with, you want to get a feel for them and see if that's the right style for you.
Totally. And, I think something that you do really well with clients is like the psychoeducation or just education around this.
Yes,
and
they're getting education whether or not they want it.
Got a lot for you. But I think that's sometimes a really good buy-in for people who aren't sure about working with a dietitian, of like, my body is scary to me, but you're there to help me understand what's going on inside it. And sometimes like that's a starting point that people are a little bit more comfortable, getting on board with. And
yeah.
So they
feel heard, right?
Yeah.
It's like, oh, you get it.
Mm-hmm. Totally.
So, yeah. And I think that's why there's so much power in knowledge, right? Of one, understanding my body, why I'm behaving this way, why I'm responding this way, but also to not feel so isolated and alone. Oh, this is a real thing. And they might have gotten invalidated from other providers of like what we said earlier, like, oh, you're just avoiding those foods because you're eating disorder, when there could be true physical pain that this person's, experiencing. So, yeah.
And, you've done a lot of work, obviously, with families and parents and all the things. So for people who have someone in their life who's struggling with an eating disorder and working on recovery, what have you found to be helpful ways for them to support?
Yeah. Caregivers, family. I mean, generally speaking, there's never too much support unless it becomes like, I've taken all the control away from you. And of course, it depends on the age of the child, right? If we're working with a much younger adolescent, we might need kind of that family-based, approach where parents take over all the meal planning until that person is able to make, the right decisions or even know how to navigate it, right? But yeah, leveraging, if people are comfortable bringing in a parent to session occasionally. I love to also educate on, what's going on with their body and the mental side, much like, you can provide in therapy. And because a lot of people just don't understand the psychological side of an eating disorder, and it's, well, just eat. Sure. Right? And it's so much more complex than that. And so I think like even just giving that education and that like tips for communication at meal times and how to support, and we don't need to, sit there and like, tell them to eat, but more so hear them out of like what's going on. Tips for communication, I think. And if there is a way to leverage family of, can we sit together and have meals together to have that accountability? Or, I think this is also a great place where like recovery coaches can come into place and be that meal support too, if someone doesn't have a good support system, because not everyone, of course, does, right? And we might need to kind of create our own support system.
Yeah, and that hits on sort of like the mental health piece of you're connecting with people while you're eating, which is stressful, but also food is a connector in our society and it can bring people together. And so that whoever that is, yeah, if it's family or friends or a specific coach, that's a big part of it too. And just because I'm a therapist, I selfishly want to know, from your perspective, what do you think is important for therapists to understand or know about eating disorders or about treatment, sort of from your perspective as a dietitian?
And like therapists in general or eating disorder therapists?
Maybe
that,
yeah.
that could be way different.
Two different things. How about both or either? Whichever needs to know.
I mean, I'd say when we collaborate with, within our profession, we're usually talking the same language, for the most part, taking similar approaches. And, we know that it's so important to all align on goals and kind of be communicating the same goals to our clients to have much better success with their recovery process. So, I think just as long as the whole team is connected and communicating, then we're usually doing the best to support our clients. For those non-specialized therapists, I try to come more from like a do no harm approach, right? Because it can come so often from a really good place as far as like trying to counsel on, oh, you're binging. Well, why don't you try to binge on carrots instead? Right? Like that's not helpful. That's not addressing the issue and not realistic, right? And so, or, maybe things you just think you Googled of, oh, we'll just cover up all of the nutrition facts on everything. And yes, maybe there's a time and a place for that, but like we also have to teach the skills of we're going to see that information or we already have it memorized and we can't shield ourselves from everything. Like what are, some more tangible ways to go through this. So I would just say, I think the biggest thing is just the team. Like if I'm a dietitian only working with an eating disorder client, I need to get a therapist on board, possibly a psychiatrist and a medical doctor, depending on what the severity of the eating disorder. So vice versa, right? If a therapist is working with a client, now granted, I know a lot of clients are very hesitant about bringing the dietitian on and totally get it. So I think, maybe some good feedback in general is just, really encouraging and bringing it up. Don't offer once and then kind of let it go if the client's not comfortable because, there might be things that come up in session where they're asking about food. And of course, like, we can talk about food. We all eat, right? But to what extent are we maybe giving recommendations? Are we trying to counsel them on a full-on meal plan? Or, are we even sure how much they're eating? And, we're not always monitoring their weight to know if this is, working or not and what's going on there. So, yeah, I think just the importance of the team approach.
Yeah, absolutely. And yeah, it's sort of like, what is the scope of my practice and my knowledge and then what the misinformation thing again. And you're right, food is something we all know about. And so we sort of assume that maybe that we have more information or understanding of it than we really do, especially when, there's these sort of medical issues that are part of it or the gastrointestinal stuff.
Yeah.
So before we wrap up, I'd love if you could just share, what you're doing nowadays and where people could find you.
Absolutely. So I am in private practice, so I do outpatient only, and I see, adolescents through adults. My subspecialty, of course, is that GI and ED intersection. I really, truly enjoy working with those more medically complex clients. Maybe that means they're on specialized nutrition support or we're needing to do, different kind of, supplemental protocols for helping with some symptoms depending on what we have going on, like SIBO as an example, lots of food allergy sensitivities. And so you can find me. I have my own practice called Root Cause Nutrition, and I see people in person and virtual throughout Arizona and some of the other states around the area. The licensure requirements are ever changing. So I always tell someone just, let's see where you're at. I'll research it. And if I can work with you. Yeah. Yeah. Yeah.
Cool. Thank you so much, Liz, for coming. And you'll be able to find Liz's information under the video. And have a great day.
Thank you.